Excellent. Thank you. Thanks for joining us on this Friday afternoon, and also thanks for inviting me to speak today. I'll be talking about common coaching derailers, or in other words, things that happen during coaching sessions that can be completely counterproductive. And I think one way to figure out what something is also to figure out what it isn't. I think that's not going to work. Okay, so my disclosures. So I've been a part of the statewide collaborative in Michigan, and I've participated in a number of coaching sessions, both as the coach and the coachee. And I think one of the most powerful things about these sessions is it offers you an opportunity for self-reflection. Doing this outside of the operating room with a video is actually very beneficial because you don't have all the stressors of what goes on in the operating room. And I think self-reflection is the first start to self-awareness, all of which is very important for meaningful change. And so one of the first things that a coach does or should do is create that environment that fosters that sort of self-reflection. So if that's the coachee right there, this is what the coach does. Sits there and helps the coachee. Now, the second thing that a coach, I think, is very vital as part of this whole project is to be able to create these teachable or aha moments for the coachee, regardless of who they are, either a peer or a student or an instructor. And really, we know that these moments happen really once you come out of your comfort zone. Our brain has the amazing ability to create habitual sort of behaviors because it helps you do things automatically without thinking about them. In order to break those habits, you have to work extra hard. And really what happens is it takes people out of their comfort zone. And so that's where a coach can be very helpful. Now, it is possible to go too far. Once you get into an area where you're uncomfortable, it'll be impossible to create that kind of meaningful change. And actually, that's where my talk is this whole part here. So I'm going to give you sort of 5 scenarios of where these types of situations can happen and hopefully help give you some advice to mitigate those types of things. So the first one is a break in confidentiality. So similar themes that we've heard earlier. Developing trust is really important. Once you lose trust, it's really hard to open up to really talk about sort of your concerns about a particular procedure. If I know that my coach is going to go blab about my complications, I'm not really going to talk to them about how I want to reduce my leak rate or what have you. So developing trust is important. And you can do that with the initial interaction. The first thing my wife always tells me is, like, don't be a douchebag, right? Be respectful of the person that you're working with. When you're doing a peer-to-peer interaction, it's a lot easier than that tension between attending and instructor. But very simple, very obvious. You can introduce yourself. When you introduce yourself, you find common ground. When you find common ground, talk about the cases that you do, how many do you do a year, what kind of practice that you have. Do you have residents in the room? When you're speaking with a peer and going through one of your videos, having that common ground is important. When you do that, you can also figure out where the boundaries are, where you're going to be talking about, what you're going to be talking about during the session. And really it comes down to being attentive to the coachee. You want to make sure that you're compatible with the coachee's style, their needs, and what their goals are. Now, as part of our collaborative, we went a little bit further with this and trying to create some definitions in order to make coaches and coachees compatible. One thing was, of course, coachees wanted to be taught by people that were at least better than them in terms of outcomes. But really, compatibility between the coach and coachee goes way beyond that. So we all took one of these sort of Myers-Briggs personality tests, and it talks about, whether you're an extrovert, whether you're a thinking, judging type of person, and here's me actually. Thinking, judging, introverted, intuition. I can only surmise from that I have a terrible fear of public speaking, but here I am. So what we did with this is we found other people that are compatible with this, and that's who I was paired up with as a coach when I was coached. And I found that important. Again, that relationship is really important in order to make the experience worthwhile. Okay, so the second thing. Lack of process and goals. We've talked a lot about that today, about how goals are important because you can debrief with all of those at the end. Without that, then it's just mindless chatter. And it feels good, you basically stay in the comfort zone the whole time. And we do this all the time, especially when two surgeons, practicing surgeons, get together. I'm sure we've all done it in the last few days here when you meet your old buddies and you regale each other with these stories of, oh, the patient and this is what happened. That's all great, but you may not take anything out of that whole conversation when you have it. So really having some focus is important. So create goals and structure, and we've talked about this a little bit earlier, and it really comes down to some clarity and some specificity. This is actually from one of the interactions I had when I was a coach. And the person I was coaching was 65 years old, so had a few extra years on me. But we wanted to get down to why the person was there. How could I possibly help them do a better sleeve gastrectomy? I'm sure they know how to do it. But it really came down to is I want to get better. So I was like, well, what does that mean to you? Because I know what it means to me. Well, they wanted to be more efficient. That's very different than what I was thinking about, so that's good that they brought it up. So everything that we did from then on in when we watched the video was about, does that look more efficient or less efficient? Was that what you wanted to do? Is there a way you can make that faster? So it guided the whole inquiry, and it brought us back when we debriefed at the end. Which parts of the operation did you think you could be more efficient, and how are you going to do it? And which ones are you feeling comfortable to do next time you operate? So goals and structures are important. So acting in rescue mode. So what this basically means, and this is very natural and intuitive for many people who teach residents, is you basically tell them what to do. But it takes the responsibility away from the person the coachee, the person that's trying to learn from the entire environment. And again, it's all about being in the comfort zone. If you're telling them exactly and pointing things out and telling them what to do, it's paint by number, they're in their comfort zone, they're never really going to get out into this area. So a couple things to do with that is actually let them struggle a little bit. That comfortable silence, we've watched a few videos, and yeah, you watch that and you kind of test them out about, do you feel good about that? You ask them those kind of gut sort of questions to get it out of them. And it's a bit of a struggle, but enjoying that struggle is how you get to that self-awareness that you need in order to make meaningful change. The other thing I've noticed about this is talking about alternative interpretations and perception gap. You know, I see something on the screen. Are we seeing the same thing? We're watching the same video. What does this part of the operation mean to you? And because I kind of see it a little bit differently. So really focusing on that really kind of gets into the coachee's brain or the learner's brain. And creating hypotheticals is also another good example of doing that. So one example was we were talking about port placement as part of the operation. How could we be more efficient? So so what if the BMI was this? So what if the person had a hernia? So I created all these hypotheticals just to get a sense of like, why did they put their ports there to begin with? Was it just something somebody told them? Did it evolve over time? Was it something they read in a book? So it really kind of gets down to the nitty-gritty about the rationale behind certain decisions we make in the operating room. Reverting to the expert. Similar sort of theme, you basically lose the focus of the coachee. When we're watching videos and the coach is talking the whole time, I would do it this way, I wouldn't do it that way, I see this, I don't see that. Really the coachee is a passive sort of participant in all this, and everything's just going to go over the head. There's not going to be anything at the end to hold on to in order to change for the next time. And it can also feel a little bit like this. Remember, we're talking about creating a state of self-reflection and self-awareness. When you turn to the expert, it's just not fun. You just listen to them the whole time. And remember those pictures earlier, the difference between the coach and the coachee is the coach is actually listening the majority of the time. So my advice with that is be the coach, not the player. So provide the structure, create the environment, ask the questions, but don't give the answers. Let the coachee think through it. And that brings me to my last point, and that's about asking questions, which is really kind of an art form, and it takes time to develop. So that's why I think over the course of 2 years, we start getting better and better of coaches, and it's a little hard to do in just a few hours by just getting sort of a little bit of structure. But certainly there's a difference between interrogation and inquiry. When people are kind of interrogated, they can get into the defensive mode, and they either clam up and don't really want to talk about anything, or they give you responses that really don't help them get to where they want to go. So the types of questions you need to ask really have to seek to understand. You're trying to figure out the reasons behind how they make certain decisions, what their rationale is, and really challenge the limits of the rationale. And again, we can do this by asking hypotheticals while we're watching the video. And again, it's, I think, another important point of why we do this outside of the operating room, because it's hard to get into these really deep kinds of questions intraoperatively. I like to ask questions like, does that look appropriate? Does it look adequate? Does that part of the dissection, do you feel like you're proficient in that or deficient? Or what's your main goal of getting to that portion of the operation? How do you get from A to B? And when do you consider it a proficient move or something that you can work on? And of course, we can explore a range of possibilities with that. As a coach, I also like to brainstorm sort of ideas that will help them to improve whatever segment of the operation that they want to improve. So to summarize, a coach has to establish trust. They need to provide the structure. They have to encourage the coachee to problem solve. They have to act as a co-learner, again, and not as an expert. And the types of questions are really key. They have to explore reasoning and rationale and not be interrogative. And that's how you get to a state of self-reflection. And that's really what I think is important with all these sessions, because it'll lead you to meaningful change. That's all I got. Thank you.